everyone. My name is Abinash Singh and I am presenting the topic on electrocardiogram along with Ritacheta ray. So firstly we will come to the introduction and try to understand what ECG actually means. An electrocardiogram, also termed an ECG or a 12-lead ECG, is a simple non-invasive test that records the heart's electrical activity. It is used all over the world because of its simpleness and because it's non-invasive and it's painless for the patient. The electrodes that are connected to the sensors of the machine, they do not provide any electrical source, which is major concern for all the patients that undergo a ECG test. And therefore, it is very simple and very easy to use. This is the person. His name is William Einthoven. He was the first person to record an ECG in 1902 by placing his limbs in buckets of the conducting solution. He is known as the father of ECG, and he got a Nobel Prize in 1924 for the invention of ECG machine. Secondly, we will go to the anatomy of the heart. I will try to make you understand how the blood flows to the heart. The blood flows to the heart through firstly to the superior vena cava, and then it goes into the right coronary artery. Then it goes to the right ventricles through the tricuspid valve, and then it picks up oxygen from the lungs. Then it goes back into the heart by pulmonary veins, and then it goes into the left atrium, then it goes into the left ventricle via mitral valve, and then it goes out of the heart and into the tissues via aortic valve and through the aorta. So when can a doctor can ask us to have an ECG exam? These are the following signs and symptoms. Firstly, it's chest pain. Secondly, dizziness, lightheadedness or confusion. Thirdly, heart palpitations. Palpitations actually means if a person has an unusual heartbeat or an extra heartbeat, or he is missing a heartbeat from time to time. In such cases, Holter monitors are given to the patients, which will record his heart 24/7 and will give the results to the central hospital. The fourth is rapid pulse rate. The fifth is shortness of breath, and the sixth point is weakness, fatigue, or a decline in ability to exercise. These are the symptoms or signs when a technician or when a doctor can prescribe the patient to go through an ECG test. Then the detection of diseases. What kind of diseases can we detect via an ECG exam? The first is heart rate. There are two type of heart conditions uh, which an ECG test can tell us. It can detect. The first is tachycardia. It is an unusually fast heart rate, and the second is bradycardia. It means an unusually slow heart rate. Second, it comes to the heart rhythm. Arrhythmia. It means an irregular heartbeat, a missed heartbeat, or anything like that. An ECG test can detect it. Third is, and it's the most important point, is the heart attack. ECG exam can show us if a person, if a patient has had any previous heart attack or is going through a heart attack, and it can also tell us where which part of the heart is really affected and the extent of the damage. Fourth, the blood and oxygen supply to the heart. It can tell us if there is an inadequate blood supply to the heart, which is causing chest pain. And the fifth is heart structural changes. If the heart is enlarged or any defect, if there are any defects in the heart, an ECG test can determine it and detect it. What about the last ECG signal? What happened to that? Last ECG, sir, heart structural changes, right?
No, sir, it's talking about the signal. Why it is not there? It's not there. The ECG signal is not there.
It got cut now. Sir, that was the design that the computer gave. I didn't put it there. You have to make a PPT, na? Yeah, sir. I thought about it. Computer will give many things. Yeah. You have to do it. Sir, she is going to explain all that. That was the design. You are presenting it. Yes, sir. I completely understand. Yeah, yeah. Then we will go through the flow of electrical current into the heart. The current flows in from the heart through the from the electronegative inner surface of the heart to the electropositive outer surface. From the base of the heart to the apex of the heart. An electrode is placed. If an electrode is placed near the electronegative side, it has an electronegative potential, and if it is placed near the apex of the heart, it has an electropositive potential. Then we'll go through the lead placement system. There is an internationally accepted 10-12 lead system which consists of 10 electrodes and 12 leads for measuring a person's electrical activity of the heart. The first type is bipolar lead system. The bipolar leads has two different potential at two different ends, and this was given by Enthoven, the father of ECG, who got the Nobel Prize in 1924 for discovering it. So here the three leads are placed at left arm, right arm, and the left leg, and it has different potential at each end, as you can see. And these and the equation that is given there, it is known as the Enthoven equation, and he also told us that lead 1 plus lead 3 will result into lead 2. Then we'll go into unipolar augmented lead system. This was given by Goldberg. Yeah, it has three leads, AVF, AVL, and AVR. A stands for augmented, V stands for voltage, and F stands for foot, R stands for right arm, L stands for left arm. And this was the equation, the above equation that we can all see. This was given by Goldberg, and it's known as Goldberg equation. It helps it helps us in determining where the leads are to be placed in with respect to the lead 1, 2, and 3. Then we come to the precordial lead system. There are as I said, there are 12 leads in total. Lead 1, lead 2, and lead 3, and then AVF, AVR, and AVL, and there are 6 more leads, which is V1, V2, V3, V4, and V5, and V6. And accordingly, the the electrodes are placed on our chest. Firstly, the V1 electrode is placed on our chest, which is placed in between the fourth, which is placed in fourth intercostal space, and to the right of the sternum. The intercostal space is referred to the space in between the ribs, and the fourth intercostal space means the space in between the fourth and the fifth rib. And similarly for V2, it's placed in the left of the sternum in the fourth intercostal space. For the V3, it's placed in between V4 and V6. For V6, then the V6 is placed, and it is placed on the same level as V4 and V5 into the anterior axillary line. Then V5 is placed, it is placed on the same level as V4 but in the mid axillary line. And for V4, it is placed in the fifth intercostal space in the mid clavicular line of the heart, of the chest. Then we are going to the hex-axial reference system. This is the system which is internationally accepted, and it helps us in determining the heart's electrical activity in the frontal plane of a human body. Here we can see how all the leads and how all the electrodes are placed in the chest accordingly to the frontal plane of the heart. The From minus 30 to plus 90, it is the normal axis. From minus 30 to minus 90, it is the left axis deviation. And from plus 90 to plus 180, it is the right axis deviation. And from plus 180 to minus 90, it is the extreme axis deviation. The magnitude, the amplitude of the heart, the amplitude of the electrical axis of the heart is determined by how perpendicular the depolarization current moves to the axis of the lead. If it is really perpendicular, then the magnitude of the amplitude will be really high at that certain point, and that is how the electrical potential of the heart is determined via ECG. Then my classmate Ritacheta will present.
Thank you so much. Now let us understand that what is cardiac cycle. So actually cardiac cycle, it is all the electrical activity or the electrical processes that occur during a single heartbeat. Now the cardiac cycle, it consists of majorly two phases. One is the diastole and the other one is the systole. So diastole, the diastole, it is measured when the heart muscles or the myocardium they relax, and systole, it is measured when the heart muscles they contract. Now let us understand the cardiac cycle as well as the ECG graphical representation together. So we know that blood in the heart, it always travels from a region of high pressure to a region of low pressure. Now in the beginning, there is an excitation. Now our heart, there is a particular type of cell which is known as the sinoatrial node. Now, that acts as the natural pacemaker of the heart. That is rather in an easier way to explain it is that it causes it gives in the excitation that is needed for the blood from the atrium for the atrium to contract and the blood from the atrium to pump out into the ventricles. So the pumping or the contraction of the atrium leads to the formation of the P wave in the ECG graphical representation. So the P wave in the ECG graphical representation, it serves as to be the range or the region for atrial depolarization. Depolarization may be defined as when contraction takes place and there is pumping out of blood from the atrium to the ventricles. Next comes the QRS complex. So the QRS complex. So after the atrium, it releases the blood. Next, the QRS complex, it determines the ventricular depolarization or the time taken for the ventricles to contract. Next comes the T wave. So the T wave, it actually signifies the time that is taken for the ventricles to repolarize or rather to relax, so that there can be a generation of another excitation and thereby propagation of another P wave again. Now we have seen that the ventricles, they depolarize. The depolarization of the ventricles, it can be seen through the QRS complex, and then the ventricles, they repolarize. That can be depicted via the T wave. Now there must be a question that why doesn't the auricles or the atrium, they repolarize? Of course they do repolarize, but it is so much minute and it is in between the QRS complex that it is not seen. Okay, so now let us understand that what do we mean by the cardiac action potential. So this cardiac action potential, one thing that we need to know is that the cardiac action potential and the action potential of the skeletal action potential is slightly different. Why it is different, we will come to know shortly. So this cardiac action potential, it is actually the measurement of the change in the voltage of the membrane voltage change due to the working of certain ion channels. Now this cardiac action potential, it has major 5 phases. So let us start by understanding each of the phases, right? So first, as we can see here, this is the resting membrane potential, that is the phase 0. So now at the phase 0, what happens? There is now during in this cardiac cells, there are action of mainly 3 ion channels. The first, it is the voltage gated Na channels, then is the voltage gated potassium channels, and there is another special kind of ion, that is the calcium ion, but it is a slow calcium ion channel, or rather it is also known as the L-type slow calcium ion channels. So as we can see here, so at the first phase 0, what happens? The voltage gated Na channels, they open, and due to this there is an influx of Na plus ions into the cardiac cells. Now this results in the acceleration of the cells from the resting membrane potential to the resting membrane potential, which is usually around minus 70 to minus 80 to plus 20 millivolts. Now, next comes in the phase 1. Now, what happens in the phase 1? There is the closing of the Na plus voltage gated Na channels, and there is the opening of the potassium, the voltage gated potassium channels. Now, it is actually what happens during phase 1. There is an efflux of potassium occurs. Now what is efflux? Efflux, it is generally the release of potassium ions. Now earlier we saw in phase 0 that there was an influx, that is, or inflow of sodium ions into the cell. Now as a result of which, sodium ion, as we know, it is a highly electropositive ion. So there is a accumulation of positive charge into the cell. Now potassium ions, they tend to go out of the cell. Hence there is a slight negative charge into the cell, and because of which we can see that there is a slight decline in the curve. Now at the same time, as when the efflux of potassium ions occur, there is also an influx of calcium ions, but the calcium ion influx, it is very slow. Now as you can see here, the influx of the calcium ions that leads to this generation of phase 2 or the plateau region. Now, why is this plateau region? And this plateau region formation is actually the differentiating factor between cardiac cell action potential and the skeletal cell action potential. Now, as we see here in phase 1, what happens? There was an efflux of potassium ions. Now, but in phase 2, as I said, that calcium ions, there was an influx. So it is almost equal to like how now both calcium as well as potassium ions, they are both positively charged. Hence, the amount of positive charge that is going out is actually balanced by the amount of positive charge via the Ca2 plus ions that is getting into the cell. It is kind of getting balanced. Hence, there is no net change in the membrane potential, and hence we obtain this plateau region. Now after this we come into the phase 3, wherein there is the closure of the channels, the potassium as well as the calcium channels. This leads to a phase of rapid repolarization, or rather relaxation of the cells, and then comes in the phase 4. The phase 4, of course, phase 4 needs to be attained so that the next excitation can occur. Now the excitation, the excitation of the cells, the next potential, it can either occur through the passage of the ion channels, passage of the ions via the gap junctions, or it can either occur by any other excitation. Now, why is the shape of the ECG waveform like this? So the main concept that why the ECG waveform shape is like this, it is because that we each of the leads, as my classmate explained, that there are a number of leads, and all those leads, they actually look at the heart, or they evaluate the electrical activity of the heart from various different positions, and thereby we obtain this kind of a shaped waveform. Now, one thing that needs to be remembered is that when the electrical activity within the heart, it travels towards the lead, we obtain a positive deflection. And if the electrical activity, it moves away, or it travels away from the lead, we obtain a negative deflection. And on the basis of this positive deflection and negative deflection that is seen in the ECG waveform, we are able, or rather a medical professional, he or she is able to determine that if the patient is if the patient is normal or is undergoing any abnormalities. Now, how to read an ECG paper? So now this ECG paper, it is actually standardized across all hospitals and throughout the world. Now here we can see that these big box, so there are, in this big box there are 5 small boxes, and each small box, each small box, which represents 0.04 seconds. And now in this big box we have 5 small boxes, thereby this each like 0.04 into we have 5, so we get the each large box, it represents 0.2 seconds. So what happens, we calculate for any medical professional when evaluating a patient's ECG graph, they check the boxes, the large box that the P wave is falling, and the large boxes, they count the box in between the where the QRS complex is falling, and thereby they can evaluate that if the patient is healthy, normal, or is having any abnormality. Lastly, of course, we'll conclude by saying that ECG, or electrocardiogram, it is the most efficient way of detecting any cardiac abnormality. It is a non-invasive method wherein the patient is not going through any pain to record his or her electrical activity of the heart. Thank you, sir, for providing us this opportunity where we could present our work through this flipped classroom concept. Thank you.